It's your turn to talk family health with Dr. Elizabeth Vaughan. Good morning again.
Good morning.
Let's get straight to the phone lines. We have Janine holding in Winston-Salem. Good morning, Janine. What's your question?
Good morning. I am a 52-year-old woman and have gone through menopause. This will be my second year that I've gone through, but I have just now started to have a period. Could you tell me why I would be having a period and what I need to do?
This is very common, but you do want to follow up with your OB-GYN. Most of the times, it's kind of like the last hurrah. Your ovaries just got it together enough for you to be able to have a period. But you want to make absolutely certain that this is not a sign of early uterine cancer. So your physician will probably want to do either an ultrasound on you and possibly even an endometrial biopsy. There are drugs, and I use the drugs also, that make certain that it doesn't happen again. So I would follow up with your OB-GYN. Don't panic, though.
Let's go to Jane in Kernersville. Good morning, Jane. What's your question?
Good morning. I have a daughter who is in Charleston, South Carolina. She has been diagnosed with having metals in her system. Mercury is the main metal, and also candida throughout her body, and it's also gotten into her bloodstream. They're doing IV therapy for that. Is that what you would suggest?
There's some very, very fine environmental doctors down in Charleston, South Carolina. The connection there is that mercury, not uncommonly, will increase your sensitivity to getting yeast infections. It damages your immune system so that you can get yeast infections. And the answer is yes. One thing I would be doing with her would be getting the mercury out of her using chelation therapy. I would also give her nutritional IVs and also treat the candida with diet and various supplements or possibly even drugs. It's a complicated problem, and it's much more common than what people realize. But there's some excellent guys down in Charleston.
Let's go to Bobby in Summerfield. Good morning, Bobby. What's your question?
Good morning, Dr. Vaughan.
Good morning.
I have congestive heart failure, diabetes, and several other things. And I've been going to a couple of doctors and about taking my spleen. I had my spleen taken out.
Why?
And they suggest me not to get my flu shots and stuff. What do you suggest to me do?
Well, I wouldn't get a flu shot anyway because it's got mercury in it unless you could get one of the flu shots that does not have mercury in it. I would just either take a supplement or take the Tamiflu when the flu comes around. In terms of getting your spleen out or not, I can't tell you whether or not to do that, but certainly after getting your spleen out, you would want to get a particular vaccine called a pneumococcal vaccine that helps protect you from pneumococcal pneumonia, and that can be more common and it's harder to fight it off if you don't have a spleen. So follow your doctor's guidance.
Let's go to Judy in High Point. Good morning, Judy. What's your question?
Good morning, ladies.
Good morning.
A year ago, I had an aortic dissection on the back side of my aorta.
And you're here to talk about it.
Yes, ma'am. I called because I was frightened. I didn't understand what was going on. You talked to me a little bit, got me a little calmed down. Now I have to have a echocardiogram and a nuclear stress test because I just don't have any energy, and the heart's just not doing. They think it's a blockage, and I just wanted to ask you, what does that entail? I'm a little apprehensive about it.
If what you're getting is a nuclear stress test, you can take a deep breath and just relax. You will get an injection of a very, very mild radioactive dye, just like similar to getting an IVP. Not a big deal, not real dangerous for you. And then they will stress test you in some way, and they'll take some images of your heart before and after the stress test. Piece of cake compared to what you've been through before. Don't worry about it, but go ahead and have the test done. I will suggest that if you are on Lipitor or any of the statins, consider having them draw a CoQ10 serum level and make certain your CoQ10 levels are in the upper range of normal, because they can drag down your CoQ10 and contribute to heart failure or your heart not pumping as well.
Let's go to Leona in Winston-Salem. Good morning, Leona.
Good morning.
Good morning.
My question is can water retention cause leakage through the feet?
Can it cause leakage through the what?
The feet.
Leakage through the feet?
Yeah, I've formed like a rash on my foot, and it's leaking fluid like water.
I would have to say yes, but there also has to be something wrong with your foot in the first place that it would tend to leak that way. So you may have a tendency down there to have a low-grade irritation from your socks or shoes or latex or something like that that might set you up for it. But then if you have significant problems with fluid retention in your lower legs, then that can happen without any question. Key point is elevate your legs at night, just 2 to 3 inches. Put a couple of the big new phone books up underneath your mattress and lift the whole mattress up just 2 or 3 inches, and your legs will drain better overnight. And buy some really good support hose and even wear them at night, because that'll help get rid of the fluid in your legs. And also try horse chestnut. That'll help with fluid retention and helping the veins get stronger.
All right, and don't forget, about a month away from the Natural Triad Health Show.
That's right, that's right. And the headliner again is going to be Boyd Haley, who is an internationally known specialist in mercury toxicity. He's a chemist, he's not a physician. And go to the Fox 8 website or Natural Triad website to see Boyd in action at the CDC in July.
Wonderful. Thanks so much.
Thank you.
Good
That's
to see
great.
you.